The Health Secretary has been very candid about her frightening experience giving birth. After being put on an NHS ward with new mothers suffering what she described as hellish agony, she's now vowed to make women's health a top priority so others don't face what she describes as the fear that I faced. Joining me now is broadcaster Afua Hagan, also Sarah Graham, a health journalist and author of Rebel Bodies, a guide to the gender health gap revolution. We're going to start with Afua because Afua is going to be very candid indeed and honest about what she herself went through. I always see you in a very empowered, highly professional situation, Afua. I don't think I really knew that you've been through such a difficult and frightening time.
Yeah, and it really was, giving birth to my daughter 12 years ago now, at a really wonderful hospital and had really wonderful care afterwards. But the birth itself was very, very difficult. It resulted in an emergency cesarean, and both myself and my daughter in great distress. There was a chance that either one of us could not have made it. Thankfully, we did. I had very, very low heart rate. Her heart rate was very, very high, and for a number of reasons had these complications that made birth very, very difficult. We are both still here, which is amazing, but that's not the case for lots of women up and down the country. And it's great that Victoria Atkins is talking about her difficult birth story and the fact that women's health does need to be in the spotlight. And when it comes to maternal deaths, we actually have some of the highest maternal death rates in the world. And we're in a country where Black women are 4 times more likely than their white counterparts to die in childbirth. And that's something that really, really you need to have a spotlight on. We talk about this plan for women's health that she set out for 2024, but it's not just about women giving birth, it's all the other things to do with women's health. Endometriosis, for instance, the average time for a diagnosis is 7.5 years. That's ridiculous for a woman to be living with
If
such
I were to
pain and
ask you, Afua,
discomfort for that length of
sorry to
time.
interrupt you, but if I were to ask you, and I know it's a difficult question to answer, I realise that, but if I were to say, why do you think it is that Black women are at so much greater risk that somehow after all these years, even though so many health professionals, including midwives, of course, and nurses, doctors, are Black, Afro-Caribbean or African, why is it that Black women do receive a substandard, inferior kind of healthcare? What is the factor that makes that happen? What would you say?
I, I think there's many, many layers. There's lots of different reasons why Black women have these outcomes. And the statistics are quite similar in the United States. I think they're 3 times more likely to die in childbirth. I think there's a few reasons. I think, first of all, Black women are not believed when they talk about how much pain they are in. So that can contribute to you potentially being in so much more pain than you are in and someone not believing you. I think there's issues with the way that Black patients, not just women, have been written about in healthcare textbooks to do with pain, but also to do with needles going through their skin and things like that. I think it's also the way that we are treated and the way that we are perceived throughout pregnancy. Like I said, not believe when it comes to pain, not believe when it comes to lots of different conditions. Black people are also more likely, I think it's twice as likely, to live in poverty. So therefore, you may not eat as well as someone else who has more money than you, and that can contribute to your health throughout pregnancy. I think there's lots of different reasons why the outcomes are worse. And it's not just during childbirth, it's childbirth and the first 6 weeks after. So I think there's also issues around aftercare, around health visitors, and around mental health as well. I think it's many, many layers.
Afua, thank you so much. Sarah Graham, let me come to you. I mean, we hear a great deal, and you certainly will hear it on my programme, because I think it's incredibly important to talk about this, of what is being called misogyny in the national health system, so that women in general, Black women in particular, get a completely different service from the NHS. How are you defining that in your book and in the articles that you are writing about this?
Yeah, absolutely. So the book explores what I call the gender health gap, which looks at the really kind of complex differences in the care that women receive. And I think, it is such a tricky issue. We have, cultural issues where women in general, Black women in particular, are less likely to be believed. So you know, a lot of my work stemmed from interviewing women who would say things to me like, I feel like my doctor wasn't taking me seriously. They weren't listening. They didn't believe me. They dismissed my pain, or they kind of normalized what I was going through. And then we've also got issues around medical knowledge. So we know that historically there has been less research into the conditions that disproportionately affect women. There has been less research done on women's bodies. Historically, women were excluded from clinical trials. So there are all these different layers to it, on top of, you know, the individual biases that healthcare professionals, doctors, nurses, midwives each bring into their day-to-day practice.
So we have Victoria Atkins here now saying, I have experienced this. She calls it the dark side of the NHS. She remembers how she felt lying in that maternity ward, you know, hearing women talk about the dreadful suffering they'd been through and realising this wasn't right, this wasn't a decent standard of care at all. So very, very briefly, Afua, do you feel hope that this is now being dealt with? People are focusing on it and it can't be allowed to continue?
Well, I do feel a glimmer of hope, yes. But what I think Victoria Atkins doesn't realise is, amongst myself and my friends who are Black and who are mothers, our stories are all the same. Our stories are all about the difficult births that we had, the trauma that we went through, very similar to hers. And I think she needs to realise how much more common that this is. That yes, there is that dark side to the NHS, and that people have gone through these really traumatic experiences, and it's actually more common than she realises. So I hope actually that she is putting a real proper focus on women's health, birth, menopause, endometriosis, fibroids, everything, cancer, everything to do with women's health.
Thank you both very much indeed for joining me.